For anyone in the healthcare industry looking to expand their knowledge. It's just www.medlineuniversity.com. You have to just create a username and password, but it's free. You don't need to even be associated with the facility to go on and take the courses. But there's a lot of great education specific to skin and wound care on there. There's a whole table of contents just on skin and wound care courses. So that's a nice kind of feature that Medline offers to nursing staff, as well as actually it expands into materials management. But there are a lot of great nursing courses, and you can get CEU credits on there as well. But just quick review of the products. The Kiwi Mango is the shampoo and body wash that you guys have been using. It's just a mild surfactant cleanser, so it kind of is a nice product because we have 3 different skincare lines, and a lot of times this is a very popular cleanser because it's a mild surfactant, so it's not going to be very harsh on the skin, but it does suds, which makes things a little bit easier to clean. So it's kind of a nice balance between, surfactants are great, but harsh surfactants can kind of strip the skin of that acid mantle, the fatty acids, essential oils, which kind of hold your skin cells together. Your skin's kind of like the brick and mortar system. If you were to take the mortar out, the bricks are going to kind of crumble. Same thing with your skin. There's a lot of fatty acids and essential oils that really give your skin the integrity and keep your skin give that elasticity to help it more resilient to break down. So this is a good happy medium between cleaning and being gentle on the skin. It smells nice. Just a nice basic shampoo and body wash. As far as your lotion, I think you guys have used a few different lotions, but now we're doing the basic moisturizer. It's just a nice daily moisturizer to help keep that moisture in the skin. After bathing, it's very important to use a head-to-toe moisturizer to help, again, reinforce those fatty acids, essential oils to help strengthen the skin, keep the elasticity, and prevent any type of breakdown. You also use a lot of our Remedy skincare products. Remedy's the latest technology in skincare. The big thing about Remedy is, number one, we use the latest technology in moisturizers, barriers, but also we add an element of nutrition to all of our products. So, sometimes in long-term care, your residents, they don't get as much nutrition as they could from their diet. So this skincare line kind of acts as a supplement to kind of nourish the skin, along with moisturizing, cleansing, and protecting the skin. So the products that use there, it's a plant-based nutrition, so it has a lot of antioxidants, amino acids, MSM, which is like an anti-itch, anti-inflammatory, as well as vitamins to help keep the skin healthy. So the first product is your barrier. HydraGuard is a silicone-based barrier. Silicone is the latest technology in barriers. And some of the nice features about the silicone barriers, number one, they protect the skin really well from urine, stool. They're just a nice moisture barrier for the skin. But there is an oxygen exchange that takes place at the skin, and the silicone allows, it's a breathable layer of protection, so it allows that oxygen exchange, which is important for skin health. It also works really well with your incontinent pads or any type of incontinence products. It's not going to clog up the pores of your briefs, and it's going to help them do their job, which is very important to keep that moisture off the skin. So it's just a nice breathable layer that doesn't clog up your underpads. It goes on very easily, removes very easily, and it's also very wash-off resistant. So we've done testing on some of our silicone barriers, and after 5 washings, there's still traces of the product. So even though you want to reapply after every incontinent episode, there is a nice layer of protection there. It is wash-off resistant. So this is our HydraGuard. Again, it's 24% silicone, and it really repels moisture. I mean, if you put this on your hands and wash your hands, you'll notice that the water really repels off this product. Plus, the residents like it. It smells nice. With our Remedy products, when you the fragrance that you smell, it smells like vanilla. It's not a perfume. It's actually vanilla extract. So These remedy products are sulfate-free, paraben-free, aloe-free, so they're designed for, you know, geriatric patients, neonatal patients, patients with sensitive skin. So it's a very high-end, clinically tested line. So this is your basic barrier for prevention. Let's say you have a resident that maybe has a few incontinent episodes and the skin starts to break down a little bit and you start to get some redness and weepiness. That's when you'd want to switch to the orange barrier, which is more of a occlusive zinc type barrier. So it's not a breathable layer of protection. It's going to be occlusive. It's going to really protect that skin while the skin is healing. So this product here, it's a little bit thicker, and when you apply it, it seems like everyone wants to cake this product on a little bit. Really goes a long way with this product, and you should almost be able to read the paper through it. So you don't need to have a thick layer for your barrier. Right there is more than enough product. It seems like this stuff always gets caked on, and it's just, number one, you don't want to waste it. Number two, it comes off a lot easier when you use just a thin layer. So that's more than enough for protection, because this product is micronized, so a very light amount is going to give you a lot of protection. And then comes off very easily when you use a light layer. And then if there's an area where, you know, it's not coming off all the way, as long as you've cleaned up your urine, stool, if there's a little bit left on, it's fine. You don't want to cause any breakdown to the skin trying to, you know, remove any areas where it might be, you know, caked down a little bit and not coming off quite as easily. So this is your basic prevention barrier, and then this is your open barrier. So blue is your basic barrier, orange is your open barrier, and then, you know, once the skin is healthy, you can go back to the blue product. So your usage on the HydroGuard should be a lot higher than your usage on the Z-Guard, because this is what you're using for pretty much all of your incontinent residents, and then this product would just be used on your residents that have a little bit, again, of breakdown. In addition to incontinence, the silicone barriers, what they are is they're tiny microscopic medical grade glass beads. So everything kind of rolls. It really reduces friction and shear. So if you have maybe a resident that is at really high risk for breakdown, you can use this on bony prominence. It's going to help reduce friction and shear as well. So you know, mostly for your incontinent barrier, but you can also use it on bony prominence to reduce friction and shear. So the HydroGuard is your basic barrier, and the Z-Guard is your open barrier. Any questions on any of the products so far? And then, excuse me, lastly, red is for rash. These are our two antifungal products. Comes in a cream and a powder. They're both 2% biconazole nitrate. So it's prescription grade antifungal over the counter, and this stuff works really well. Powder typically works really well in areas where there's a lot of moisture. You don't want to donate moisture to an area that already has a lot of moisture. So skin folds, the groin area, any area where there's a lot of you know, buildup of moisture, you want to use something like a powder that'll help, you know, kind of have a drying effect in addition to treating any type of yeast infection. And then we also have the antifungal cream as well. So those are the skincare products, and you know, this, if any of you remember the Calazyme, this is very similar. They do the same thing. Like it's just that the orange barriers are for your open areas. So everything's kind of color coded. You have your blues, your basic barrier, orange is your open, and then your red is your antifungal. Any questions on the products? I know you guys have been using them for a while, but everything's working well with the skincare.
Are you guys applying the HydroGuard? Do you know if your aides are applying the HydroGuard between each incontinent?
Yep, that's part of our policy for incontinent care.
You guys having high success with it? Do they like it and everything too?
I think so, but I think it's fine. Yeah. Mm-hmm. Some of the residents are using the Z-Guard because it's more like a zinc desitin. So if they're a person that's had potential or has had an area resolved, a lot of times we end up with Z-Guard. long-term.
Just if you have a patient
Mhm.
that's at high risk.
Mhm.
Yeah, I mean, this is gonna offer like a more occlusive barrier, it is a little heavier. So, this is your treatment barrier, but, if you have a resident that needs something a little extra, this is a good option, just a light layer. But your usage overall should be higher on the hydro, which I think it is.
Mhm.
I looked yesterday, and it looks like your usage is pretty in line with the norm as far as the breakdown of the usage products. Any other questions on the skincare? All right, now as far as your wound care products. And I apologize, I'm a little short on catalogs. How many catalogs do you need? I'm gonna order you a bunch and I can bring them in for your...
I think I have 2 in my office.
Okay.
So, do you have one? Yeah, so, I mean, we have probably 4
Okay,
in the
I'll
facility.
get you, we updated them
Okay.
fairly recently, so I do wanna get some new catalogs in here.
Okay.
I can bring that next week.
But we just came out with a new one, so there's a little bit of shortage kind of as we phased out the old ones and kind of brought the new ones in. So I do want to get new ones because there's
We have meetings. Yep.
but I just kind of want to go through the catalog just so you, or where some of the products and programs and kind of how the catalog is designed. But if you start in the back of the catalog, it has all of our educational programs, like Medline University is in here. Our educational packaging, which you're probably familiar with, and I'll kind of review that as I go through the products. Kind of the educational formulary posters that we've done for you guys, like the guidelines here. And then these are actually also being redone. It's been probably 10 years or so since these pocket guides have been redone. So we're in the process of updating these. And what they are, they kind of have product information like the catalog, but in addition to product information, there is a lot more kind of general wound information on staging and kind of breakdowns of what those stages look like, even a little more detail than the guidelines have. So these are really good references as well. And I don't know exactly when these will be available, but they're nice little tools to have just as an overview of products and kind of like a general, wound care knowledge reference guide. And also, on the back of all the catalogs, there's a hotline. It's 1-888-701-SKIN. We have 8 WCNs that work with Medline, and one of them is on call from 9 to 6, Monday through Friday. Every week. So if there's any question that you have, or maybe you see a wound that you've never seen before, or product question, appropriateness of a certain product, this is a great resource. There's 8 WCNs, and each one is on call like for a specific week, and they just rotate every week. So they are available Monday through Friday. They're definitely pretty easy to access because that's basically their role for that week. So take advantage of the skincare hotline if you ever have any questions. And then some of our support services products are in the back. But kind of moving back to the beginning, just want to show you how this catalog is kind of broken down, and I'll go through the different categories. So we use the DIMES acronym when we put this catalog together. And the DIMES acronym, it's not anything Medline came up with. It was designed by some leading wound experts. And what the DIMES acronym is, it's just a method for kind of treating a wound bed or preparing a wound bed. So the DIMES, D is for debridement, I is for infection control, M is for moisture balance, E is for edge, and then S is for supportive products and educational services. So according to the DIMES acronym, when you're looking at a wound, you want to see if there's any debridement that needs to take place. Is there any necrotic tissue, slough, eschar? If there's debridement, you want to make sure you get that slough, eschar out of the wound. Give yourself a nice healthy wound bed to start, hopefully begin closure. So we have our debridement products in the beginning of the catalog. Then we have our infection control. If there's an infection in the wound, that's obviously high priority, so we want to make sure we're addressing any type of infection. So all of our silver products are in the infection control. Silver is a very powerful antimicrobial in low amounts, and it's also very resistant to building up an immunity to it. So there's no known immunity to silver as an antimicrobial, so it works very well. We use an ionic release of silver in our products, so that is a slow, steady release of silver. So it gives you longer wear time, it gives you a steadier release of silver throughout the wear time of that dressing, and it doesn't stain the skin because it's at a slow, steady dose. When it stains the skin, that's an indication that it may be toxic to the wound or to the skin. So we have a slow, steady release of silver, but much more than you would need to heal a wound. Again, silver is very powerful in low doses. So we have a lot of great silver products for your infected wounds. Then after infection, we have moisture balance, because you really need to get the right balance of moisture in the wound bed. If you have a dry cell or a dry wound, a dry cell is a dead cell. A wet wound is going to be susceptible to maceration and infection, so you really want to get a nice moisture balance. So we have products that are going to donate, products that are going to absorb moisture. And then in the edge environment, those are more of our kind of more clinical products for a wound that might need something a little extra, maybe a chronic or a stalled wound, maybe a wound that there's a lot of comorbidities going on. These are kind of dressings that really requires some really extra treatment to get that wound kick-started. So you won't use a lot of those, but they're very effective when you do have a chronic wound that you're just not really having any success treating the moisture and the infection and the debridement with. They work really well for those cases. And then in the end, we have all of our supportive products, your tapes, your secondary dressings, and our educational services that I kind of ran through with you. So to kind of start here with the wound care, do you want me to start with what you're currently using, or kind of go through the catalog, what works better, or just the products that you're currently using? Okay.
Yeah.
So the first product in our moisture balance is our Arglaz powder. This is a great product for a couple of reasons. Number one, the way that it works, it comes out in a powdered mist. So if you have an infected wound that has some tracking or tunneling, like nooks and crannies, this product comes out in a powdered mist, and it helps get into those hard to reach areas to address any type of pathogen. But it's kind of a nice tool to have on hand. So let's say you need a silver dressing and you don't have one, you can add, like let's say you need a silver foam, you could add this to any dressing and you can make it into a silver dressing. So just a kind of a neat product for those types of wounds. It's kind of like a calcium alginate ground up, so it will actually absorb light drainage as well as treating pathogens. So when you're looking, when you look at the guidelines, it kind of breaks it down by category, and then also takes it a step further and looks at drainage. So when you're looking at a wound, the big thing you want to look at is, okay, here's a wound and I'm trying to absorb drainage, or I'm trying to donate moisture, or I'm trying to kill bacteria. Basically, what am I trying to accomplish, and then find the dressing that meets that goal. So, if you have a heavily draining wound, then you want to find something that's going to absorb that drainage. If you have an infected wound, you want to have a silver product. So, basically all these products are kind of designed to handle moisture, pathogens, and just give it that right environment for wound healing. So, next product for heavily draining is our OptiLock. This is kind of like a non-adhesive type foam. So let's say you have a really nasty, heavily draining wound. Nothing really is giving you more than a day wear time. This product is like a sponge, comes in multiple sizes, and from a 3x3 all the way to now we have an 8.5 by 13, which is used underneath your compression wraps. So if you have, you know, venous leg ulcers that are, you know, have a lot of drainage, you can put these underneath compression wraps, and they really give you a lot longer wear time out of those wraps. Then we also have the 4x4, the 6x6, and all the in-between sizes as well. But just a really good product for drainage. Depending on where the wound is, you could picture frame it with tape, or you could wrap it with a cling, depending on where the wound is. So this is a great product for, you know, your moisture management products.
Pass that around.
Yeah, for sure. And then Exoderm, this is our hydrocolloid. These used to be the most highly used wound care dressing. Foams have kind of taken that spot, but there's still a place for these dressings. They're going to absorb up to a moderate amount of drainage. They're occlusive, so they work really well, you know, around the sacral area or areas where, you know, there's, you know, any type of moisture, urine, stool. It's going to keep that off the wound, prevent that from kind of getting into the dressing. So it is an occlusive dressing that's going to handle moisture. We have a couple different versions. They're all pretty similar. This one has odor technology. This is the Exoderm Odor Shield that has the same technology that Febreze has, so it will lock away odor molecules. So these typically, I see these used again like the sacral area. One little trick when you're using these to help keep them in place, you know, any type of dressing that you use in the sacral area seems to be a tough area to keep the dressing on. Obviously, there's a lot of bending. You know, there's urine, stool that can interfere. So when you're using, this comes in a sacral shape as well. But if you just fold these down the natural crease, and then fold down the edges like you were making a paper airplane, just to open up a little area right at the seam of the dressing. You always want to start at the bottom and then work your way up. So if you start at the top and then the gluteal cleft there is always the hardest part to adhere. If you adhere that last, it creates a lot of tension right on that area, and it tends to pop off, and then once anything gets underneath it, the dressing is on its way off. So always start at the bottom, so you can start the gluteal cleft there. This is a really nice adhesive, and it's actually activated by heat. Once it's kind of warmed up by the body, it really sticks nicely. And then you want to just work your way out and up one side at a time. So then when you adhere this, there's not as much tension on it, and then it's going to keep this area in place much better. And once they get a nice seal, they're actually pretty tough to remove. And has anyone seen like the 3M command strips where you pull it and it releases the adhesive? This is the same way. So when you're taking it off, they can be aggressive. So you just want to pick a corner off and then kind of toffee pull around the outside, and then it will release the adhesive without causing any breakdown. So you want to skin prep the area, start at the bottom, and then work your way out and up. And these are really do a nice job of you know, holding in place and keeping out moisture and you know, covering up any type of, you know, breakdown. So that's our Exoderm Odor Shield. These are all really similar. This is our Exoderm LP, which is just a thin version. Next are our foams. This is our OptiFoam, non-adhesive, comes with and without silver. When you're using a foam dressing, these have become the most widely used dressing. Reason being, they do a lot of different things. You can use them as a primary dressing. You can use them as a secondary dressing. They absorb a lot of drainage. You know, they have up to a 7-day wear time. They're just it's a versatile type dressing, so they become a widely used dressing. Sometimes they're overused because sometimes they're not necessary. There's maybe the lower cost options that, you know, for certain wounds that maybe a foam's not necessary. So like your border gauzes, which you guys use some, I can show you. But that's just our non-adhesive dressing, comes with and without silver. I mentioned, you know, you use those as a primary or a secondary dressing. The only time you're going to use a silver dressing as a foam is if you use it as a primary dressing. So if you're using a foam as a secondary dressing, you want to use your silver as your primary and then cover it with a non-silver because you want the silver right on the wound. And then just for cost purposes, the silver dressings can be as much as twice the cost or more of the non-silver versions. So, you know, just for cost purposes, you don't want to put silver on top of another silver product. So again, but those do come with and without silver. This is our OptiFoam Gentle, also comes with and without silver. The silicone technology for the adhesive is nice for two reasons. Number one, it's gentle on the wound or the skin when you remove it. So when you go to peel this off, it's very gentle on the skin, but it re-adheres very nicely. So if you need to take a peek at the wound and then stick it back down, the silicone re-adheres. Where the original kind of acrylic adhesives, once you peel it back, it kind of you're kind of lost its adhesiveness. But these re-adhere and they're very, very gentle on the skin. So this is our OptiFoam Gentle, again with and without silver. Here is the border gauze product. These are great because they come in a lot of different sizes, and these are really good for cover dressing. So let's say you're using like an alginate product, or you're using a primary dressing. You know, it can be costly to use two different products. So these are a really inexpensive way to cover up a primary dressing. So border gauze here is a good option. It has an island similar to a foam. That product as well has a nice aggressive adhesive, which, you know, is good because it stays in place, but it's a 7-day wear time. At day 1, it's going to be more aggressive when you remove it than it would at day 7. So you want to make sure you're using a skin prep. Anytime you're using an adhesive dressing, you want to use your skin prep. So you know, but particularly like a non-silicone adhesive, it's going to be more aggressive when you remove the product. So you want to make sure you use a skin prep when you're using the border gauzes. But definitely use those for cover dressings. Again, it's a little bit more cost-effective way than kind of using a foam on everything, which sometimes tends to happen. Kind of too much. Next here are our kind of alginate type products. MAQ02605. Now this is a great product for a stage 3 or 4. Has a little more depth to it and has a lot of drainage. This product here is going to absorb a lot of drainage. It's going to wick it out of the wound and into your secondary dressing. They also, when there's a wound with some depth to it, it takes up dead space too, which you don't want to just, you know, leave a big hole and cover it. It can kind of heal over the top, and you want to really try to promote healing from the base of the wound. So these take up that space and just do a nice job of managing fluid. So, you know, talking about the border gauze as a secondary dressing, this is a really good combination for you know, a heavily draining wound with a little bit of depth to it. You know, then there are those wounds that just, they drain so much you can never, you know, have enough, you know, absorption. You know, then it may be time to try, you know, this with maybe an OptiLock or you know, a foam instead of the border gauzes. But you know, this is a really good primary dressing for a heavily draining wound with some depth to it. Again, they come with and without silver, so you know, If it's not infected, this is gonna be a really good option. Your AG or your silver version is gonna be the product that you wanna use if there is any type of pathogen present in the wound. And then we have the rope version for your